This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
So I'm Cheryl Benjamin. It's really nice to meet everyone. I'm the Associate Program Director at Schwab. Thank you so much for taking the time to come out tonight to be here with us. Hopefully our Program Director, Dr. Gittler, will be getting on soon. She had some technical difficulties. So in the meanwhile, we'll go ahead and we will get started and then we'll have her say a couple words afterwards. That way we have enough time to make sure that we can answer all our questions. So Dr. Thacker, say hi.
Hello.
Is our wellness chief, and Dr. Wheelock is our advocacy and outreach chief. And both of those will be presenting a presentation and hopefully a little bit of a video if we have enough time. And then we'll be answering any questions that you guys have. So please feel free to put them in the chat and we'll definitely try and get to them all. So thank you.
All right, guys, welcome, welcome. I'm just gonna share my screen now so we can chat here. All right, can everyone see my slides?
We cannot see them yet.
We can't see them.
Okay, let me see here. Zoom, share screen, share. Okay.
Perfect. Well, Dr. Thacker is getting the slides up and loaded. Dr. Gittler actually was able to get on, so we'll have her do a quick intro, and then hopefully by then we'll get the presentation up and going.
Well, thank you all for taking the time. I'm not sure where you all are, but it is a pretty steamy Tuesday night. And I don't know, hopefully that's probably why you guys all are having your pictures up and not your faces, or at least not your whole bodies. And I think we're up with our presentation. Anyway, we're very excited to introduce you to Schwab. All of the programs are great. You know, you're going to learn great stuff everywhere. And we just want you to understand why Schwab might be the right program for you in terms of your interest in social responsibility, diverse communities, and advocacy. So take it away.
All right. Can everyone see my slides now? I just want to confirm.
Yes, we can see it.
Awesome. All right. Welcome, everyone. Thank you so much, PM&R Scholars, for hosting this event, allowing us to talk about Schwab Rehabilitation / University of Chicago PM&R Residency Program. I'm Karan. This is Corey. I'm going to tell you more about the program. All right. Go ahead, Corey.
Like Karan said, my name is Corey. I'm from the University of Minnesota, actually originally coming to Schwab here now for residency. And so one of the reasons that many of which drew me to Schwab was that our mission is to develop outstanding rehabilitation physicians who practice with a social conscious. Our clinicians and trainees are community and patient focused, and I believe in the social justice and advocacy. That's the PM&R mission for Schwab Rehab, which is just so true to us. We stick by it every single day. It's so very, very evidence in our patient population. As you can read, we're very challenged by multiple social determinants of health, poverty, low health literacy, low educational attainment, unemployment, food insecurity, housing, high crime, just so many different things. And so all the candidates here at Schwab embody that mission quite well.
Yeah. All right, so huge thing happened, 2020, ACGME and Arnold P. Gold Foundation, DeWitt C. Baldwin, sponsoring institution award. What that means, this award recognizes institutions with accredited residency programs that are doing real well and doing what we just talked about, which is fostering a respectful and supportive environment for medical education, delivery of patient care, specifically in our environment. Schwab is the only rehab hospital in the country to receive this award, and so we're very proud of it.
A little bit of an overview on our PM&R residency. We are a freestanding rehab facility on the Chicago West Side. We have about 60 acute inpatient rehab beds, and then we also have an outpatient physician's clinic located on our second floor, and then also an outpatient therapy gym. So it's really, truly an all-in-one kind of experience there for PM&R. Some of the hospitals that we're affiliated with, the one we're probably closely affiliated with is Sinai Health System. It's right across the street from us, but we truly get referrals from all over the Chicago and surrounding communities, sometimes even out of states. So you really got a very broad patient population there, but truly Chicago West Side is probably home to us. It's a 3-year advanced ACGME accredited residency program. We have 5 residents per class, usually 15 total. And then our academic affiliation, where we do most of our research, where we do most of our anatomy lab, all that kind of stuff, is at the University of Chicago Pritzker School of Medicine. We also do some work at the University of Illinois Chicago as well.
Thank you. So PGY2, we are an advanced program. So this is your first year at Schwab. You'll be doing 5 rotation blocks, all here at Schwab, both inpatient and then a couple weeks of outpatient as well. 10 weeks total per rotation, as you see here. And then you also get some outpatient exposure PGY2 year. But really, like most programs, PGY2 year is inpatient heavy here at Schwab. And then you get a little bit of outpatient, but PGY3 and 4, which we'll talk about next, is where you get your outpatient experience really fleshed out. But you are performing lumbar epidural steroid injections your second year with Dr. Watson. He's awesome. I can't wait for you to meet him. Admission cap at 1 admit for 4+ months. This is huge. We protect your time so you can learn slowly, and you can learn well, rather. And then when you're ready to kind of up your efficiency, we can put you at 2 admissions, but this is a huge one. 1-to-1 faculty resident ratio. I love this. I work directly with our attendings, which we'll get to later on. Great mentorship, great research, great medical student mentorship as well. If you've rotated with us, you know this. And then what rotations do you have? Well, you work with Dr. Greif on the general amputee post-COVID recovery unit, Dr. Mecki and Dr. Kreis on stroke, Dr. Kopp, she runs a spinal cord injury. I'm sorry, Dr. Lee runs a spinal cord injury, and Dr. Gittler also steps in. Dr. Kopp runs the brain injury clinic, and then outpatient clinic, like I mentioned, you get about 10 weeks of experience there.
Perfect. Moving on to your PGY3 year, it's 5 rotation blocks. Each one of them is about 10 weeks total per rotation, although that's also cut up into 5-week blocks as well. So you'll spend some time at North Shore Health System. This is an outpatient specialty clinic, primarily for the sports and spine. It's about a 30-minute commute up North Shore. You get to drive along beautiful Lake Michigan, so it's actually a pretty nice commute back and forth.
It is nice, yeah.
Traffic never gets too bad on Lakeshore Drive. You just got nice views, so that's good. Then we do inpatient consults at the University of Chicago, which is a great time down there. That's in Hyde Park. That's about 15 minutes down south from us, where it usually are. We do interventional pain management at the University of Chicago and the Elmhurst Neurosciences Institute. It's kind of a nice broad pain experience. University of Chicago is an anesthesia-run pain experience, so you get to work very closely with the anesthesia residents. You get to do a lot of research with them. They have a fellowship there. So you're working closely with fellows and doing research with them as well. Elmhurst Neurosciences Institute is a completely PM&R backed interventional pain program. So that's really nice to see, kind of people who are near and dear to the PM&R community out there practicing, and who are very, great advocates for you to practice there as well. We do EMGs and electrodynamics of medicine at Schwab, as well as the University of Illinois. And then we do musculoskeletal and sports medicine at the University of Illinois Flame Center.
Yes, which is awesome. We work directly with the program director, who's a Schwab grad, and we get to work with the Division I team, which we'll talk about. So North Shore, like Corey mentioned, is a nice drive over. It's located in a couple of different suburbs of Illinois. You've heard of these if you're from around here. We get to do interventional pain, rheumatology, sports and spine stuff, MSK radiology, lymphedema clinic. You can read these things here, but the main point here is that you get plenty of experience early in your 3rd year. So if you're interested in fellowship, you get some experience early on.
And another thing is that if you would like to do any elective experience back up there in any of those kind of subcategories, that's also a great additional exposure you can get. The University of Chicago Medical Center is another one. We do interventional pain and spine there, as well as inpatient consults. This is a massive academic center. It's a level 1 trauma center. We primarily take care of strokes, organ transplants, amputations, debility deconditioning, also commonly known as critical illness myopathy and neuropathy sometimes. Cancer, rare diseases. Down there, you'll get to do weekly trauma rounds with the trauma service. That's really good, kind of just in your face, kind of just exposure to the trauma experience and all the things that they think about. And then we get to add kind of how we would like to transition their care to the next phase, which is rehab. Another kind of just bonus of this facility is that there's a personal office just for you. You have dual monitors. You just go in there, you're completely alone, and you're able to just get your work done, which is great.
Yes, dual monitors, huge, huge. And you work with Dr. Benjamin, which you met earlier in the presentation. All right, UIC sports medicine rotation. I apologize, this Zoom taskbar might be covering the slides, the name of the slide, but I'll read it out to you. It's the sports medicine rotation we have at UIC, located at the Flame Center, like Corey mentioned earlier. We do plenty of procedures here with Dr. Verma, who is the program director and a grad of Schwab. We do peripheral joint injections, ultrasound injections, prolotherapy, trigger points, dry needling, Division I sideline sports coverage. This is pretty awesome. You can cover baseball, basketball, soccer, whatever you're interested in. Chicago Marathon coverage. I did this last year, ended up being right in front of my apartment. It's a pretty awesome experience. Orthopedics, MSK clinic. Other big things, athletic training, of course. We are downstairs underneath exactly where all the athletes are practicing. So you're kind of really accessible during the day if there's any injuries. Concussion management, you get to biomechanics evaluations if you're interested. And then, of course, the associated sports and pain fellowships. Great connection to have when you're a Schwab resident.
For EMGs and our electrodiagnostic medicine experience in our PGY 3-year, we work with both PM&R and neurology, which is, again, really nice kind of breadth of experience in the neurology side of things, as well as the PM&R. There's a very strong emphasis on technical execution, as well as interpretation of the report writing. Sorry. We also get an AA and EM membership access for free every year. So that's really nice. There's a lot of online modules, as well as kind of sights and sounds things that you can listen to kind of really improve your experience there. We do average just a multitude of cases, 250 plus is kind of the average Schwab resident. So we don't have any issues hitting our numbers whatsoever.
All right, next up, interventional pain medicine, which has been a pretty hot field the last couple of years. We get plenty of experience in interventional pain. We do plenty of procedures over at U of C, Elmhurst, and at Sinai as well. Your second year, PGY2, you're starting off doing procedures, epidural steroid injections. The other ones you see here, you'll be doing it over at U of C. That's facet joint injections, peripheral nerve blocks, SI joints, baclofen pump refills, spinal cord stimulators. And they, of course, have a great pain fellowship. And so we rotate directly with that fellow. You work directly with that fellow and performing fellowships with, procedures with them as well. You get to do some MSK spine there as well. And then also they have some pretty cutting edge things like ketamine infusions that they do there for cancer pain. So really good experience.
All right, moving on to the PGY 4-year. We're looking at 4-week rotation blocks. They're starting off with inpatient consults. That's primarily at our hospital across the street, Mount Sinai, which is nice to be close to home. There's also a junior attending experience, and coupled with that is a subacute rehab experience that you can also do. This is where you're going to be the senior resident on the inpatient rehab team at Schwab. You're going to be able to teach both residents and med students just kind of, everything that you've learned in your last couple of years as being a PM&R resident. We do electrodiagnostics again in the 4th year just to continue to kind of make sure that those skills are still close to your fingertips when you're graduating at both Schwab and U of I. We do a PT, OT, speech, and prosthetic and orthotic rotation at Schwab and Hanger Clinic. We have the phone numbers to the Hanger Clinic rep that we work with, and they're very closely. Any questions we have, any problems that we come up with on the inpatient rehab side, can immediately ask them about, which is really nice. We also do a very specific neuromuscular medicine rotation at the U of I. This is run by the neurology team there and their neuromuscular clinic that they have, which is great experience. We also do pediatric rehab. This can be optionally done in your 3rd year. It doesn't have to be done in the 4th year. It's done at Shriners Hospital. There is an associated fellowship with it. Again, you're working closely with fellows. If you're interested in it, there's a great track that you can kind of just put yourself into. And then, of course, there's 8 weeks of electives where you can really just do whatever you want, which is, again, what everyone wants to have.
Yeah. And if you're interested in pediatric rehab, like Corey said, you can do this rotation your 3rd year. And this rotation is great. As someone who's not going into peds rehab, I feel like I got a great experience there. You do gait analysis in the morning with Dr. Mukherjee and her staff. You see inpatient and the outpatient setting and in your weeks at Shriners. It's honestly an awesome rotation. So if you have some interest in pediatric rehab, definitely want you to message us if you have any questions about Shriners. So next up, I'm just going to summarize this slide real quick. You are going to blow these numbers out of the water. Like Corey said, your EMGs, you get over 250 if you want them. If you want more than that, by all means, take the next EMG. I will watch. Axial epidural injections, you do plenty. You do more than 5. Your PGY 2-year alone. Facet, SI joint nerve blocks, you do these at U of C, which is awesome. You'll have plenty more than 5. So you guys can Google this and read about requirements, but just know that you guys will do much more beyond these numbers.
Moving on to kind of the education that we get that just goes throughout each year. We do weekly didactics from 8 to 11 on every Thursday. This is completely protected time. Put the pagers away. You don't have to worry about them. You're really just learning on those days, and your attendings are writing all the notes. There's daily lunch and learns as a PGY2 that is done in the resident room around lunchtime. Grab your food, sit at the table, learn something about PM&R. It's really nice. We have monthly, we call them CSI. They're basically M&Ms, just going over different things that have happened over the course of the rehab stays of our patient, as well as journal clubs, keeping up to date with the most recent research being done. We do monthly grand rounds that kind of just, you slowly go through the list of residents. You don't have to do too many, but it's nice as well to do those presentations, and then you can put them on your resume as well. There's a lot of self-directed study stuff that you can do. We have a shared access drive that has basically every study resource you could want. We have one of our chiefs that is very big into the self-directed resources.
We're at about 5 minutes.
Okay, thank you so much. Academic and professional society conference participation is highly encouraged. We definitely want you to go to APM&R every year. Quality improvement projects, you do that as PGY4. You can have multiple of them. You can have one. It doesn't matter. There's a dedicated elective for it, actually. We also do cadaver anatomy lab at the University of Chicago every December. We do a pediatric gait lab at Shriners. And then we do the annual self-assessment exams just for everyone.
Quickly want to highlight someone with Sandy, our one of chief residents. He has access to everything. Okay, so we have PM&R recap on our resources. We have the Weiss, we have Cucarillo, we have everything you need. PM&R recap, especially as a big high yield one. So we have access to all the study resources that you're going to use to study for your exams, which is awesome. Benefits, similar to other programs, we have our insurance and our benefits. But the main ones I want to point out: 15 vacation days, 3 personal days, plenty of money to go to present posters. Get a nice educational stipend, stipend, $275 annual per year. Plenty of time to do interviews, etc. I do want to keep some time for interviews, so I'm going to go past the slide. Questions. Schwab in-house call details. No one wants to talk about call, but just know that it gets better as you go on, like most programs. This year we're only doing 15. Here's our lovely faculty. Dr. Gittler and Dr. Benjamin are on the call now. They'll chat with you. And here is us and others. We're all cool. Some fun pictures, and you can start asking some questions, guys. The chat is already popping. Let's see here. Dr. Gittler, Dr. Benjamin, feel free to hop on. Yeah, that is a great photo.
Okay. Some people.
I think Dr. Gittler and I were trying to busily answer those questions that were coming up.
Thank you so much.
But if anyone has any other questions that you want to put in the chat, or if you want to just come out and ask the questions, we're happy to answer. And I'll try and put, because I know we're kind of running out of time, I'll try and put the link directly to our website, which also has a video of the actual of Schwab itself, so that way everybody can see it too.
I do want to just address this question in the chat about how receptive is the faculty toward resident-driven initiatives. And, I'd ask the residents, I wouldn't ask me. I, of course, feel like most of the changes in the program have been made because of the feedback we get from the residents. There's some things we do less of, some we do more of, and some things we changed or rearranged because the residents thought that the experience should be earlier or later. Healthcare is difficult right now, and it's hard enough for all of you to advocate for yourselves. And I know that we are asking a lot of our residents, but we're asking you, in addition to being a resident, to be an advocate for the communities that we work in. We work in some of the communities of Chicago that struggle with social determinants of health way before they've had a disability. And getting people home is a triumph and a challenge. And I think we all learn how not just to advocate, but to be allies for people that may not look like us or have backgrounds like us, but we recognize how important it is to optimize their access to outstanding care. Is that time?
You have about 1 minute left altogether.
Okay. It's one question was, what changes or opportunities are we looking forward to? Huge change. We're going live with Epic. We've been in the Meditech world for a very long time. So we're very excited about that, which is a big deal. And, I think the biggest change we're looking at is, even though COVID's not gone, the impact of COVID on our rotations, on what we could do, where we could do it, the way things were changed. I think we're looking forward to some more stability and getting a better sense for our more junior residents of solidifying their physical exam skills. You will have the best physical exam of any physician, period. Mostly as a rehab doctor, but especially as a Schwab doctor. Subtle findings make the difference between knowing that someone does or doesn't need imaging and what their outcomes are going to be. And I think there's nothing better than getting a consult from a service, because they don't really know what's going on with their patient and they want you to get the story and get the exam done. And that's who we are.
Thank you all so much from Schwab. We really appreciate everyone jumping on, doing such a great presentation. Thank you all very much.
Of course. Thanks for
Thank
having
you.
us.
Good time.
Bye.